Inflammation is a hot topic in health circles these days, and for good reason. It plays a crucial role in our well-being, acting as a double-edged sword. On one hand, it's a natural and essential part of our body's defense system, helping us heal from injuries and fight off infections. On the other hand, when inflammation becomes chronic, it can silently wreak havoc on our health, increasing the risk of various diseases. Think of acute inflammation like a helpful fire alarm. When you experience an injury, such as a cut or sprain, your body triggers an inflammatory response. This response sends a rush of blood and immune cells to the injured area, causing redness, swelling, heat, and pain. These are all signs that your body is hard at work repairing the damage. Chronic inflammation, however, is like a fire alarm that's stuck on, constantly blaring even when there's no real danger. This low-grade, persistent inflammation doesn't produce the same noticeable symptoms as acute inflammation, which is why it's often referred to as silent inflammation. Instead, it simmers quietly within our bodies, damaging tissues and organs over time. Understanding the difference between acute and chronic inflammation is crucial for maintaining optimal health. While acute inflammation is a vital part of healing, chronic inflammation is a silent threat that needs to be addressed. By learning to identify the triggers of chronic inflammation and adopting a lifestyle that minimizes its impact, we can help our bodies stay healthy and resilient for years to come. Inflammation is the body's natural defense mechanism, a complex biological response that helps us heal and protect ourselves from harm. When we experience an injury, such as a cut or a burn, or when our bodies encounter harmful invaders like bacteria or viruses, our immune system leaps into action, triggering an inflammatory response. Imagine this. You accidentally cut your finger while chopping vegetables. Immediately, your body senses the injury and activates its intricate defense system. Blood vessels at the cut site widen, allowing more blood to flow to the area, bringing with it an army of white blood cells, the body's first responders. This influx of blood causes the characteristic redness and warmth associated with inflammation. As the white blood cells arrive on the scene, they get to work attacking any invading bacteria or debris, preventing infection and clearing out damaged cells. This process often leads to the accumulation of fluid, causing swelling, which helps to isolate the injured area and contain the damage. The pain you feel is your body's way of telling you to protect the injured area and avoid further harm. This intricate inflammatory response, while sometimes uncomfortable, is a testament to our body's remarkable ability to heal and protect itself. It's a vital part of our immune system, ensuring that minor injuries don't turn into major health concerns. Understanding this process can help us appreciate the importance of supporting our body's natural defenses. While acute inflammation is a crucial part of healing, chronic inflammation is a different story altogether. When inflammation persists over long periods, it can become detrimental to our health, setting the stage for various chronic diseases. This low-grade, persistent inflammation often flies under the radar, lacking the obvious signs of acute inflammation like redness, swelling, and pain. Chronic inflammation is like a slow-burning fire, silently smoldering within our bodies, causing damage that accumulates over time. This ongoing inflammation can damage blood vessels, organs, and tissues, increasing the risk of a wide range of health problems. These include heart disease, stroke, type 2 diabetes, cancer, arthritis, Alzheimer's disease, and autoimmune disorders. One of the key drivers of chronic inflammation is our modern lifestyle. Factors such as poor diet, stress, lack of sleep, smoking, environmental toxins, and even gut health can all contribute to chronic inflammation. For example, a diet high in processed foods, sugar, and unhealthy fats can trigger inflammatory responses in the body, while chronic stress can lead to the release of hormones that promote inflammation. Recognizing the link between chronic inflammation and these chronic diseases is crucial for prevention and early intervention. By addressing the root causes of inflammation through lifestyle changes, we can help our bodies dampen the flames of chronic inflammation and reduce our risk of developing these serious health conditions. The good news is that we can take charge of our health and combat chronic inflammation by adopting a holistic approach that addresses the root causes. By making simple yet powerful lifestyle changes, we can help our bodies naturally reduce inflammation and promote overall well-being. One of the most impactful ways to combat inflammation is through a nutrient-rich anti-inflammatory diet. Focus on consuming whole, unprocessed foods such as fruits, vegetables, whole grains, legumes, nuts, and seeds. These foods are packed with antioxidants and phytonutrients that help fight inflammation. Incorporate healthy fats like those found in olive oil, avocados, and fatty fish, which contain omega-3 fatty acids, known for their anti-inflammatory properties. Lifestyle modifications also play a crucial role in managing inflammation. Regular physical activity helps reduce inflammation by lowering stress hormones and improving insulin sensitivity. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Prioritize quality sleep, as chronic sleep deprivation can contribute to inflammation. Manage stress through techniques like meditation, deep breathing exercises, or yoga. In some cases, supplements may be beneficial in supporting a healthy inflammatory response. Omega-3 fatty acids.